There comes a moment in almost every person's life when the healthcare system stops serving them and starts consuming them. I have watched it happen countless times. People who were living well, managing their conditions, enjoying their days, suddenly find themselves trapped in a cycle of tests and procedures and appointments that drain their energy, their savings, and their peace of mind. And the terrible truth is that many of these interventions, especially after a certain age, do not add years to life or life to years. They add anxiety. They add complications. They add burdens that were never necessary in the first place. I want you to think about this for a moment. When you were younger, going to the doctor meant getting answers, getting solutions, getting fixed. But as we age, the game changes, the body changes, the risks change, and yet the medical system often operates as though you are still 30 years old, as though every test is harmless, as though every finding must be pursued to the bitter end. But here is what I have learned after decades of practicing medicine and watching patients navigate the final chapters of their lives. More medicine is not always better medicine. More tests do not always lead to better outcomes. Sometimes the kindest and wisest thing you can do for yourself is to say no. Now, I know that sounds strange coming from a doctor. We are trained to investigate, to diagnose, to treat. We are taught that knowledge is power, that early detection saves lives, that vigilance is a virtue, and in many cases that is absolutely true. But there is a shadow side to this approach that we do not talk about nearly enough. Every test you take opens a door, and behind that door might be something significant, something that truly needs attention. But far more often, especially as you get older, what you find behind that door is uncertainty, a small nodule that might be nothing, a borderline result that could mean anything, an incidental finding that would never have caused you a single symptom in your entire life, but now requires further testing, more imaging, maybe even a biopsy or surgery, and suddenly you are on a medical treadmill that is very hard to step off. I have had patients come to me in their late 60s, early 70s, feeling fine, living their lives, and their doctor orders a full body scan or some comprehensive panel of tests because, well, why not? Better to be safe than sorry, right? And then something shows up, a tiny spot on the lung, a slight irregularity in the liver, a shadow on the pancreas, and what happens next is predictable. More scans, consultations with specialists, biopsies, and with each step the anxiety grows. Sleep becomes difficult, enjoyment fades, life starts to revolve around medical appointments and waiting for results. And in the end, after months of stress and testing, the conclusion is often that it was nothing, or it was something so slow growing that it would never have caused a problem. But by then, the damage is done. Not physical damage necessarily, but emotional and psychological damage. The person who walked into that office feeling healthy now feels like a patient. The confidence is gone, the joy is diminished, the fear has taken root. This is not a hypothetical situation. This is something I have seen again and again, and it breaks my heart because I know that in many cases, we could have avoided the entire cascade simply by asking a different question at the beginning. Not what can we find, but what should we look for? Not what is possible to detect, but what is wise to pursue. Because the truth is, after a certain age, your body is going to have things wrong with it. Your arteries will have some plaque. Your joints will have some wear. Your organs will show signs of aging. If you go looking hard enough, you will find something. The question is whether finding it will actually help you live better or longer. And the answer, more often than people realize, is no. Let me be very clear about what I am saying and what I am not saying. I am not suggesting that you avoid all medical care. I am not telling you to ignore symptoms or skip important screenings that have proven benefits. What I am saying is that there is a difference between smart, targeted prevention and indiscriminate testing. There is a difference between pursuing something that will genuinely improve your quality of life and chasing shadows that create more harm than good. And as you get older, learning to discern between the two becomes one of the most important skills you can develop. Think about cancer screening for a moment. We have been told for years that early detection is everything. And for certain cancers, in certain age groups, that is true. Colonoscopy, for instance, has clear benefits up to a certain age. Mammography has saved lives. But even these well-established screenings have an age at which the risks start to outweigh the benefits. A colonoscopy is not a benign procedure. It requires sedation. It carries a risk of perforation, of bleeding, of complications from the prep itself. For someone in their 50s or early 60s with no symptoms and no family history, the benefits likely outweigh the risks. But for someone in their late 70s or 80s, especially if they have other health conditions, the calculation changes. The likelihood of finding a cancer that will actually affect their lifespan decreases. The likelihood of complications from the procedure itself increases, and yet the recommendation often remains the same. Keep screening, stay vigilant, do not stop. I have had this conversation with patients many times. They come in, they are 82 years old, they feel fine, and they ask me if they should have another colonoscopy. And I ask them, what are you hoping to gain from this? If we find something, are you prepared to go through surgery, chemotherapy, all the recovery and side effects that come with it? And more importantly, do you want to spend what might be your last good years fighting a disease that might not even shorten your life? Because the reality is that many cancers, particularly in very elderly patients, grow so slowly that something else will likely take them first. Heart disease, stroke, pneumonia. The cancer might be there, but it is not the thing that ends their life. So what exactly are we accomplishing by finding it? This is where medicine becomes deeply personal. There is no universal right answer. Some people want every piece of information. They want to fight every battle. They want to know everything that is happening in their body, even if they cannot do much about it. And I respect that. But others, when they really think about it, realize that what they want most is peace. They want to enjoy their grandchildren. They want to travel while they still can. They want to wake up in the morning without dread, without the weight of medical uncertainty hanging over them. And for those people, saying no to certain tests is not denial. It is wisdom. It is choosing quality of life over quantity of information. I remember a patient I took care of for many years. A kind, thoughtful person in their mid-70s. They had survived cancer once before, in their 50s, and the treatment had been brutal but successful. Years went by. They were doing well, living fully, and then during a routine follow-up, their oncologist suggested a PET scan, just to check, just to be sure, and I could see the hesitation in their eyes. They did not want to go back into that world. They did not want to be a patient again. But they also did not want to be irresponsible. They did not want to miss something that could be treated, so they had the scan. And sure enough, it showed a small area of activity, possibly cancer, possibly scar tissue. Impossible to know without a biopsy. And suddenly, this person who had been living well was thrown back into the medical machinery. More tests, more appointments, sleepless nights. And after weeks of agony, the biopsy came back benign. Nothing to worry about. But the worry had already happened. The damage was done. And when we talked afterward, They told me they wished they had never had that scan. They wished they had trusted their body, trusted their life, and kept moving forward without looking for trouble. Now, some might say that is reckless. Some might argue that you have to check, you have to know, you cannot just ignore things. But I would challenge that thinking. What we call vigilance can sometimes be fear in disguise. What we call responsibility can sometimes be an inability to accept that we are mortal, that our bodies will eventually fail, and that no amount of testing will change that fundamental truth. At some point, we have to decide what kind of life we want to live in the time we have left. Do we want to spend it in waiting rooms, or do we want to spend it living? And this does not just apply to cancer screening. It applies to cardiac testing, to imaging for every ache and pain, to blood work that checks for 100 different things that may or may not matter. I see people who get an echocardiogram every year, even though they have no symptoms, no history of heart disease, no real reason to look, except that someone somewhere decided it was a good idea. And then the echocardiogram shows some minor valve issue that has probably been there for decades, that will probably never cause a problem, but now it is on the record. Now it has to be monitored. Now there is worry. Now there are follow-up tests. And the person who came in feeling fine now feels broken. The same thing happens with imaging for back pain or knee pain or headaches. An MRI will almost always show something: bulging discs, arthritis, age-related changes. But here's what most people do not understand. Those findings do not necessarily correlate with pain. You can have a terrible-looking MRI and feel perfectly fine. You can have a pristine MRI and be in agony. The image does not tell the whole story, but once you see that report, once you read about degeneration and abnormalities, it changes how you think about your body. It makes you fragile. It makes you afraid to move, afraid to live, afraid that you are falling apart. And in many cases, that fear is more disabling than the actual physical problem. I am not saying you should never get an MRI. I am saying you should ask why. What will change based on the results? If the answer is that you will do physical therapy either way, that you will manage pain either way, that you will keep moving either way, then maybe you do not need the test. Maybe what you need is reassurance that movement is safe, that aging does not mean breaking, that you can trust your body even if it is not perfect, because perfection is not the goal. Function is the goal. Quality of life is the goal, and sometimes the test gets in the way of that. After many years as a doctor, I began to notice a pattern. The patients who aged best, who maintained their independence and their joy the longest, were not necessarily the ones who had the most medical care. They were the ones who had the right medical care. They treated serious problems. They managed chronic conditions thoughtfully. But they also knew when to stop looking for trouble. They knew when enough was enough. They trusted their bodies. They listened to symptoms, but they did not go searching for disease in the absence of symptoms. They lived their lives forward, not backward. They did not spend their energy trying to prevent every possible bad outcome. They spent their energy doing things that mattered to them. And I think there is profound wisdom in that approach, because here is the uncomfortable truth that we do not talk about enough in medicine. We cannot prevent death. We can delay it sometimes. We can manage disease. We can relieve suffering. But we cannot stop the inevitable. And the more we try, the more we medicalize the final years of life, the more we risk losing the very thing we are trying to preserve, which is the ability to live well. I have seen people spend their last years in and out of hospitals, enduring procedure after procedure, test after test, hoping to buy a little more time, and in the process, they lose the quality of the time they have. They lose their strength. They lose their autonomy. They lose the simple pleasures of being home, being comfortable, being surrounded by people they love. This is why I believe that one of the most important conversations you can have, especially as you move into your 60s and beyond, is a conversation about your goals, not your medical goals, but your life goals. What matters most to you? What do you want to be able to do? What are you willing to tolerate and what are you not? And then you make medical decisions based on those answers. If your goal is to be able to play with your grandchildren, then yes, we should address the knee pain. We should optimize your strength and mobility. But do we need to chase every abnormal lab value? Probably not. If your goal is to travel, to see the world while you still can, then maybe we focus on keeping you stable and functional rather than pursuing aggressive interventions that will keep you sidelined for months. The point is that medicine should serve your life, not the other way around. And too often, especially as people age, it becomes the other way around. Life starts to serve medicine. Everything revolves around appointments and medications and tests. And somewhere along the way, the person gets lost. The individual with hopes and dreams and preferences gets reduced to a collection of diagnoses and lab values. And that is a tragedy, because you are not your cholesterol level. You are not your bone density score. You are not a series of test results. You are a human being with a finite amount of time and energy, and how you choose to spend that time and energy matters more than any test ever could. So what does this mean practically? It means asking questions. When your doctor recommends a test, ask what they are looking for. Ask what will happen if they find something. Ask what will happen if they do not. Ask if the test will change the treatment plan. Ask about the risks of the test itself. Ask if this is something that will truly benefit you, or if it is just standard protocol. And then make a decision based on your values, your priorities, your sense of what kind of life you want to live. You have that right. You have that power. And using it is not being difficult or non-compliant. It is being thoughtful. It is being an active participant in your own care. And here's something else I want you to consider. Sometimes the greatest gift you can give yourself is permission to stop fighting. Permission to accept that your body is aging, that things are not going to be perfect, and that is okay. You do not have to fix everything. You do not have to optimize everything. You do not have to be in a constant battle against decline. You can just be. You can focus on what is working rather than what is not. You can appreciate what your body can still do rather than mourning what it cannot. You can live in the present rather than obsessing over every possible future threat. And that shift in perspective, that letting go of the need to control and monitor and test everything, can bring a kind of peace that no medical intervention ever could. I am not romanticizing aging. I am not pretending it is easy or pleasant. Bodies break down, energy fades, losses accumulate. I see it every day in my practice. But I also see that how people navigate this process varies enormously. Some people fight it every step of the way, and they end up exhausted and bitter. Others accept it with grace, and they find a kind of freedom in letting go. They stop trying to be who they were at 40 and instead embrace who they are now. They stop measuring themselves against an impossible standard and start appreciating the small victories. A good night's sleep, a walk in the park, a meal with friends. These things become enough, and in becoming enough, they become everything. This is what I hope for every person I care for, not that they live forever because they will not, not that they avoid every illness because they cannot, but that they live well, that they maintain their dignity, that they stay connected to what matters, that they do not spend their final years afraid, chasing test results, trapped in a system that promises more than it can deliver. I want them to be free, free to make choices that reflect their values, free to say no when something does not serve them, free to live on their own terms for as long as possible. And if that means refusing certain tests, so be it. If that means accepting some uncertainty, some risk, in exchange for peace of mind and quality of life, I support that. Because at the end of the day, you are the one living in your body. You are the one who has to deal with the consequences of every test, every procedure, every intervention. And you deserve to have a say in what those consequences are. You deserve to be heard. You deserve to be respected. And you deserve to live your final years, whether that is 5 years or 25 years, in a way that feels right to you. So I encourage you to think carefully about the tests that are offered to you. Do not just go along because someone in a white coat said so. Do not assume that more testing equals better care. Ask questions. Advocate for yourself. And remember that sometimes the bravest and wisest thing you can do is nothing at all. Just live. Just be. Just trust that you will know if something is truly wrong, and when that time comes, you can address it. But until then, give yourself permission to enjoy the life you have worked so hard to build. You have earned that, you deserve that, and no test result in the world is worth sacrificing your peace.